pleasure to have Adi to be here as our featured speaker on the special month about children's health. And my staff told me I should give a little bit of a comment about why we have this dental hour. It's exactly for this reason. You know, it's initially actually it was immediately right March 18th. The idea came to my mind that we need to have this gathering support system for each other, talk, share, and bring positive energy. And one of our colleagues just recently was in my office, and he said, "Thank you." You know, it surprised me. He said, "Thank you for those hours during shutdown. We did 3 days a week, 2 hours each, sit down and talk about dentistry and what was happening." So that was the main focus: support, you know, information, education, inspire each other, bring us together. And it has not ended yet. It has actually turned into another beautiful transition with the help of my staff, that you're the first to say, now we're turning it into more of an interactive speaker. And pediatric is very close to me. I almost became a pediatric dentist. and I'm very thankful we did this. So now beyond this point is more the same idea: inform each other, educate, inspire each other on the topics that are of interest. So all that is mainly why this dental hour exists. And I'm very lucky, like you, that my wife is very supportive of it. But I'm transitioning to every other Wednesday, right? And every Wednesday, I've been doing this since the beginning, every Wednesday, but now it's every other Wednesday. Give a break, bring smiles to my wife's face. She knows that there are weeks I'm not doing it on Wednesdays. We're going to do it on Monday. There's more requests for Mondays. Now, putting all that to the side, most important, it's you. Because I'm realizing how blessed I am to do this, because I'm getting to know colleagues. I'm getting to know, and sharing each other's life experience builds such a valuable bond among each other for all of us, because we are here. How often do we have these moments? And these are the special moments. And not only I have to emphasize the moment you said that you went to undergrad and graduate UCLA, you and I connected right away, because I did the same. Very few did that. I know very few that have done that. So it's a great pleasure. But at the same time, you are with a group of incredible pediatric dentists, the Lasky Pediatric Family Home Group, where Dad started it, and it's now Michael, his son, and the daughter-in-law, who's also a pediatric dentist, and you. How lucky they are to have you. That it's truly a home than anything else. I know it's 50 plus years of a family legacy in there, which is wonderful that you're part of that. It's amazing in what you do, because as I've got to know you, I'm impressed. I thought I work hard. You have 3 kids, 2 daughters and a son, 5, 4, and 2. It's incredible. We spread it out 3.5 from between the first and the second, and from the second to the third, 8 years apart. we have long spreads. You have them back to back, and you teach full time, and you work part time with in private practice. It's impressive. And you said besides all that, you're such an amazing lady. You have also, I like to call it adopted. You called it first child. Your Shiba Inu, Luca. I love it, you know, to don't know all this about you. And now the one thing that I can share that you and we have in common, besides being Bruins, we love what we do. And that's why you are here to talk tonight. And that's why I'm here to do the dental hour, because we truly love what we do. And I appreciate very much for you to take your time to come and share with us your hobby, your passion. And besides that, I think you have a lot to share with us. So I'm gonna give the floor to you. Oh, by the way, any questions you have, or please bring it up in the chat section of your Zoom. And Peggy, thank you for putting all this together. Ray is somewhere here, her partner, and
we're both here.
Yeah, thanks for your support, and the rest of my team. And so Adi, Dr. If I may say it correctly, Genish, the floor is yours, and please take over.
Cool. So what I'm going to do is, because we've had some time to chat, I'm just going to sort of go through what I think we touched on a lot of what I was going to discuss with you guys, but I'll share it again so we can sort of see it. So can you all see my screen?
Yes.
Okay.
Yes.
You can all see it?
Yes.
Awesome. So again, these are my wonderful mentors, Jill and Michael, so sweet and helpful and caring. And, just going back to what we were sort of talking about is just the importance of just how early we get to see these families. And, beyond that, I think you guys are seeing the adults, but you're seeing the parents before they're parents, right? So before they even have children, I mean, it's just this life cycle, right? I think it's just so important. Even if it's a pregnant mommy that's coming to get her teeth cleaned, it's a beautiful opportunity to impart some knowledge for that baby that's going to have teeth one day. And so our job is obviously to educate those families and the children, and that's why our academy wants children to come when they're no later than 12 months. And it's really for information for the family and the parents. And again, we have an obligation to educate and inform and advocate for the families. That's my job. That's, I think, a lot of us, why we went into healthcare is we want to help people, and we want to be able to make sure that what we do goes beyond just teeth. We want to reach out. We want to give families an opportunity to be like advocates for their own health and their children. And that's where we, kind of have been talking about what parenting looks like today. It's not what we are maybe traditionally used to growing up, right? Parents are a lot more involved. Information is everywhere. You can access information at any time from anywhere, right? And, this was just some examples that I put up. And this is a really good one. So it's, a 20-month-old looking for the first dental appointment. And there are hygienists saying, why are you taking her so young? I'm a dental hygienist, and we don't see patients until minimum 3 years old. So, as a general, as a group of dental health providers, I think we all need to align with the importance of, it's not just about the teeth, right? So what if the 20-month-old only has 10 teeth, right? It's about the knowledge, sharing our wealth. Again, it's just more of, we all need to, create an effort that we educate early. So here we go. We have the 5-year-old that needs a root canal, and I don't want to do it. Are there any alternatives? Seems awful pain and suffering for a baby tooth. And, parents that are not healthcare providers are saying, pull the baby tooth. It's gone bad. We don't need it. Just take out the tooth. Who cares? Right? And there's just like, I'm like, the tooth. I'm like, those teeth have to be in there until the kid's like 10, 11, 12. And so I'm kind of trolling these sites, but I see what I'm seeing in my office. The parents come in and say, well, mommy on Facebook said I should just take out the teeth, right? And so we sort of touched on how we all feel like, the information is there, and patients can come and tell you what they think is the right treatment plan, what they think is right, and how we have this kind of uphill battle in sort of rerouting and help shape treatment plans in a way that makes sense for our patients, in a way that they can trust, and sort of help guide them, even though maybe from the outside they're receiving a lot of information that contradicts what we might believe is right. Little peanut again. Every time I see that little face, I just want to squeeze it. And just again, in a year that has been so challenging for all of us, I think sort of approaching our patients, especially our younger patients, with a lot of love and a lot of patience. Families have had a very, very hard year. I think, even for my child, watching all of the, when all of the BLM riots were happening, trying to explain to my child how important it is, how racism is such a intricate part of our society and how horrible it is, but also explain why people are rioting and breaking stores and things are up in flames. Like, these are very traumatic times for our children. And I think we have an obligation to lead with kindness and patience in our practices. So again, going back to just thinking about healthy goals, realistic goals, giving families things that are reasonable. It's very hard to give parents rules and rules and rules and rules, because when you're a parent, there are so many rules and so many things that you want to do right. And I think today's society in particular, there's just, you should do this and you should do this and you shouldn't give your child this and you shouldn't give your child that. And we are constantly trying to fit this little box of what the perfect parent looks like. And everything that you add into that box makes that box very heavy. So I try to give my families very realistic goals. Are you guys eating healthy, generally healthy? Make sure that we're not snacking all day long, structured snack times. Do your best not to buy juices and things that your kid might go for. Set them up for success. And one thing I tell parents that I think sort of sticks with them is, we're programming these children for the future. We're writing it in their code. This is what we do. My kids see me do my virtual workouts and they want to participate. They see that exercise is a normal part of my life, and eating healthy. I don't buy juices and, sodas, because we talk about water being healthy. So it's just setting up our families and our kids for success by giving them goals that are very easy to do. I think during this pandemic in particular, we're sort of seeing again habits that maybe would have been lessened and are now very, very strong. So for example, my 4-year-old just got rid of her pacifier 3 weeks ago. And we were on a very healthy trajectory to get rid of that thing a year ago in February. And she didn't have it at school. But then the pandemic happened and we're all home, and she became addicted to that thing. And I was like, whatever's going to get this kid to calm down, let her have it. And I think a lot of parents sort of took that route. So now we're seeing, a lot of these habits are sort of ongoing longer than usual. But we don't need to let parents feel guilty. We need to help support them and help guide them. And Dr. P, you asked about this earlier, but when is this really a problem? Things like thumb sucking, pacifiers, bottles. It all depends on the patient, right? How old is the patient? What is the mouth doing? What are the teeth doing? How is this patient growing? Is there symmetry? So all of these things come into play when we make decisions. And this is not a decision for a patient. This is a decision for the family, because if a kid is nursing to bed and you say no more nursing, well, mommy has to deal with that. Maybe the kid's not sleeping. Maybe daddy has to wake up. So now we've made a family decision. So everything I do, everything I say to parents, I recognize that there's a bigger picture here. It's not just the patient. But I also use those moments to help the parents understand why these things are so important, right? So why is it important not to suck your thumb after a certain age? Why are we stressing that? Well, if we change the way our face is growing and our bones are growing, right, that can have a future impact in the way that we are breathing at night, right? So we do know that there's implications for sleep apnea. And all of these little things are ways that we can help guide families and get them on the right track with things that might be harder to get rid of, like these types of non-nutritive habits or nursing and so forth. This is also something that's really common and it gets missed often, especially in pediatrics. We're not looking for it. I think in adults, we're like, okay, OSA, we know that it's an issue for adults, but in children, a lot of parents don't hear their kids if they're snoring. Right? So this is something that we need to look at, especially hygiene, redness in the gingiva, knowing what to look for, even in a younger child, is all very relevant. Right? So you can even see in infants, if an infant is sleeping, you'll see that they're sleeping with their lips closed and they're breathing through their nose, right? And so if we see that that's not happening, if kids have allergies, if kids became habitual mouth breathers. So it's something that we need to address, and we're often the first to see it, even sometimes before a pediatrician. A pediatrician has a very specific way of looking at patients, and we have a very specific way of looking at patients. But I think the big picture is that there's a lot of overlap between just looking at the patient as a whole and looking at the patient from a dental standpoint. So again, just assessment of tethered tissues. Dr. P, we talked a little bit about, the implications of that. So I'm going to zip through these slides. You guys know what you're assessing for periodontal assessment. I think what we're seeing is just everything has to be age appropriate, right? So if I'm seeing major inflammation in a 3-year-old child, that's a red flag for me. Even if there's plaque, typically at 3 years old, we're not seeing something that looks like this, right? And knowing that, this is very common for a teenager in ortho. So it's all a matter of the lens that you're looking at, right? If you're looking at a 3-year-old or a 10-year-old or a 15-year-old, right? I have to put on different lenses for each thing. And that's part of the importance of being able to understand that you're dealing with a changing human. I think when we're seeing adults, they're in their full form in a lot of ways. I know, of course, with aging, we see different things, but, every 6 months in a young child, I have a different human in my chair, cognitively, developmentally.
Dr.
Yes.
Oh, Dr. Adi, there's a question from Dr. Melnick.
Yeah.
Which is, how early can you treat open bite caused by habits? And how about ortho referrals?
Okay. So in terms of malocclusion from habits, our academy says that we can treat as early as possible. So what does that mean? I have had 3-year-olds with posterior cross bites from pacifier use, and you can place an expander on that child if you can. The biggest thing is obviously behavior and also parental acceptance. So I refer to ortho when I see that there's an issue that is not going to self-resolve. For example, if it's mild crowding, I think the teeth will come in or erupt properly. A lot of times I'll hold off on that evaluation. But if I see that there's crowding that is not going to, we're not going to be able to get around, or it's going to interfere with the eruption, that's something I'm going to refer early. So especially with open bites and things like that, as early as possible is the short answer, right? Because we don't want asymmetric growth. We don't want dysmorphic craniofacial growth. So that's all something that we considered. Does that answer the question, Dr. Melnick?
Dr. Melnick, if you want to unmute yourself so you can have a conversation with Dr. Addy, that might help.
Oh, yes, that was perfect. Thank you very much.
Yeah, of course. Dr. Melnick, do you treat children in your office?
I do.
Amazing.
And I have had cases like that, like a class 3, and I did refer, immediately to the orthodontist, and and that avoided have orthodontic surgery later on. So that was
Amazing.
Yeah.
So I think, I it just like makes me so happy when I hear that family dentists are treating children, because there's just such a need. There's just such a need. And yeah, it's so important. If, whatever I tell my general dentist friends is, if it doesn't look right, just refer out, right? If you think like, hey, this bite looks funky, I just refer it. Even for me, I'm like, I don't like the way this tooth is coming in. I refer it out. It's always better to be ahead of the issue, right?
Yeah.
So
that's a great advice. Thank you very much.
thank you for your question. Yeah, so different class. This is sort of more of like a normal bite. This looks like a post-orthodontic treatment bite. You can see how the molars, align beautifully. And here you can see that these back molars here, the way that they're coming together sort of indicates that we're not sort of closing down the way it should. The teeth are not socked in properly, right? So in this case, if you look at the actual bite here, you see this is a very class 2 anterior open bite patient. So obviously this would get a referral immediately. And same thing, I do see a lot of underbites in kids. Kids are interesting though, because some kids will posture funny. So they go like this and it becomes a habit. You'll see them posturing to the point that when you ask them to bite down, they kind of just do that, okay? So it gets a little tricky, because sometimes I will tell mommy, that's not their bite. They're just habitually closing that way. And it's become, and that's an issue with sort of like the jaw and the way the muscles are. So we try to sort of remind them gently, bite on your back teeth, make sure your back teeth are touching. And a lot of times anterior cross bites in young children, like an underbite, does not necessarily mean that that's their skeletal growth pattern. A lot of kids will grow out of that once their permanent teeth come in. So if I see a 3-year-old with an underbite, I'm not jumping to refer them out, because I'm waiting to see how their 6-year molars will come together. If the 6-year molars start looking like they're going to come into the same pattern, then I'm a little bit more concerned. That's, if you see the middle picture here, this is kind of like the classic 3-year-old, because the canines look normal, okay? And then the molars look normal, but then the front teeth are definitely in a crossbite. But this is something I would kind of watch and see, because it looks like the teeth are just kind of leaning back, versus this picture here. And you can see that this is very clearly an older patient with a skeletal crossbite.
No, on the right is all messed
What's
up.
that?
Huh?
The one on the right is all sorts of messed up.
Oh, this one over here. Oh yeah. So this is actually very common also. The one on the right is like a single tooth crossbite. I can't even tell you how often I see it. And this is a very easy fix. It's like you put a little retainer with a little spring and 2 little buttons on the back teeth, and then within 2 weeks, it jumps the bite. It's very, very common.
All these are to the benefit of these kids to be seen on a regular basis by you or by dentists to notice it and to bring it to the attention of the patient and to make the right referral, and I mean it. So the skeletal growth, which is influenced by habit or alignment of teeth, can be managed early. So hopefully we can help these kids in advance.
And not just that, it's also like anticipation. So parents never like to be told, oh, well, now you have this problem. And they're like, why didn't you tell me about this earlier? Right? So I love to make sure from an early age, oh, mommy, I don't see a lot of space between those baby teeth. They look really pretty now, but when the permanent teeth come in, we're going to have a little bit of trouble. I like that the parents can say, oh, they're coming in kind of funny. I'm saving myself a phone call late at night or an email of what's going on, right? Because I'm able to educate early, right? So it's all part of the same sort of theme is, yes.
Adi, as we both have agreed that the child is under the influence of the parent.
Absolutely.
And the parent to some levels under the influence of the adult dentist.
Yes.
So here's my thought process, and my team knows, is I always analyze and look at behaviors and see how what can we do beyond what we do on a daily basis to influence the parents in order to influence the child. That means a parent that has children, it would be of benefit to say, how are your kids? There are pictures of your children. So you can see that smile line and get an impression right away. How's those dentition coming through? So we can guide them. Well, wait a second. It looks like there's a tendency of crossbite. Maybe you should consider seeing, is your child seeing a dentist or pediatric dentist? It's all leading questions. And again, this is, I know Mary and Darlene, we don't see our patients, most of them have teenagers, but some of them are young enough to have young kids. And it comes to my mind personally, many that have young kids that are Adi's age. So it is now my intention to say, let me see the picture of your kids. Love to, not only is a bonding moment, but it's also a true moment. It's a very challenging question. Is your kid seeing a dentist? We don't want to put them in a very awkward position, but leading questions that leads us to say, listen, it's important for your kid to be seeing the dentist earlier or sooner or more regular. What you're showing here is so valuable that these things have to be detected early and in your hands, and naturally from your end to the orthodontist end. As a team, you guys can make a difference.
I think so, but I also, and this is part of why I love teaching dental students, is because it's like I said earlier, it's just all very circular. You are seeing the adults and the adults are influencing the children, and, it comes full circle all the time. And then we're seeing these kids that will be your future patients, right? So we're all really working together under one common umbrella, right? We just want the best for our patients and for them to trust us with their care, right?
Mm-hmm.
Okay, so this is kind of what I was talking about with the cross bites, but same thing. So this kid clearly had some sort of habit, maybe like a pacifier or a thumb sucking, and you can see that example, right? But this is something, I'm going to monitor until the patient is old enough for us to address. But again, talking to parents, hey, mommy, I think Johnny has a crossbite, and let me show you what a crossbite is. And, you know, even in an adult patient, it's funny because I think we assume, okay, kids, we have to explain it in a kid-friendly way. But I can't tell you how many times a parent will say to me, Dr. Adi, do you see kids also? Do you see adults also, and not only kids? Because they like the explanations. They like that I'm showing them and I'm explaining in simplified terms. So I think anyone can appreciate sort of understanding something on a understandable level, like a basic level, but also just being able to be a part of your care, you know. And we're looking, so I don't know if you guys know this, but baby teeth should have space between all the teeth. When I see baby veneers, which means the teeth are all close together, like I was telling you guys earlier, I always warn the parents, it looks pretty now, but there's gonna be something when those permanent teeth comes in. And then the last kind of thing I was wanting to talk about is, and it's funny, Dr. P, I made this slide and then I saw your website and it said something about minimally invasive perio. Okay, so you're speaking my language because I'm very much about minimally invasive dentistry. And I think we're all kind of shifting towards that now, especially in the face of a pandemic where we don't want to generate aerosols. And we're now rethinking like how necessary is it to be drilling and filling, right? There are so many other ways. And so we are definitely sort of shifting. I think especially in pediatrics, we're sort of shifting gears now and moving more towards more minimally invasive techniques rather than picking up that high speed. And I think we also touched on this already, is just the kindness and the patience, being sensitive to what we've all been through this year, right? I know on just even for adults, you know, my in-laws are in their 80s and we've barely seen them in the last year. And it's a lost year. I mean, it's a lost year of time with grandma and grandpa. I'm very sad for my children. And it's just all of it. So, you know, we should all be present for each other, not just our patients, but also for each other and for our colleagues and the people that we work with, you know, just kindness and being present. So yeah, a little bit more about that. And just to close, I think we all have the same goal in mind, is just giving our patients the best tools and the most positive way of moving forward, getting them on the right track, creating good habits, and just giving them as much of our knowledge as we can without judgment, and being available to get feedback. And I think ultimately always my hope is that when the kids leave my practice, they want to bring their kids back to see me in the future. So with that, thank you guys for listening, and I hope you took something away, even if it's a small thing. And I really appreciate your time and for inviting me. Thank you, Dr. P.
This was amazing. Thank you. Many moments
Can
I
we
wanted
get
to
everybody
interrupt
together?
because a lot of what you shared was
Give them
so
a moment.
deep and important to me, and I'm sure to all of us.
us.
Here's what I have to share with you. My dear partner who has passed away, Martin Mendelssohn, as he was retiring, after 40 plus years of practicing, one of his patients approached him and said, "Doctor,
His
you
hands.
changed my life. You influenced my life. You don't remember, but that day, that moment, you told me something that triggered something that led to a change of lifestyle." We never know when. It has to do with professional and personal life, of course, how we influence others.
So true.
The same thing leads to another younger colleague of mine. I used to teach as well. And 2 years later, I saw him, he had lost 20 pounds. I said, what happened to you? He said, don't you remember that day, that moment you told me something about health and diet? That was a turning point for me.
Wow. Yes. You just don't know. And life is just like that. It's like, you just don't know what path you're going to end up taking. And any one interaction or any one, conversation could change something. I'm a dentist today because of a conversation I had
This is
with
what he's about.
orthodontist that I went to, right? So yeah, that's exactly it. So I couldn't agree more.
So as we're ending our moment, anyone wants to make a comment about this, Mary, my sweet Mary? I know I
Good.
it was emotional. I brought up Marty's comments. Anything you like to share?
And no, I appreciate it. Thank you very much. I'm trying to absorb all the stuff I've got grandchildren, two 6.5-year-olds, a 5-year-old, and a 4-year-old.
Wow.
Oh my God,
Wow.
you're like my house. Well, I'm here and I'll leave my email in the chat. If you guys have
Questions.
Absolutely.
I
Absolutely.
have a question.
I'm here, and yeah, if you have questions, I can.
Anna has a question. Go ahead.
Yes. What do you do when a kid has a parent that is neglectful? I had this girl. She was like 13, and a really terrible cross-by. She was overweight, and
What's that?
you can tell that the mom preferred her other kids. And every time I will talk to her and say, you need to take her to the orthodontist because, her bite is difficult for her to eat and it's going to cause problems with hygiene and stuff.
Yeah.
And she says, oh, yeah, yes, I will take her. And the next time will come and the same thing. And the girl will say, please tell her, I want to see an orthodontist. And it just broke my heart every time. And she totally ignored it. Finally, they move away. But I saw them for a few years, and she never did take her. And every time, I keep telling her, so what do you do in those cases? It's so hard for you.
Well, I have seen some really, I've had to call Child Protective Services a handful of times, even in the short amount of time that I've been in practice. But just in the last, especially now where it's been the pandemic and blah blah blah. But what do you do? I think it really is situational. Like if this child is coming and they're coming regularly and mommy's making appointments and meeting appointments, and a lot of families just don't have money, and orthodontics a lot of times is very expensive and not covered by insurance. So it really is very situational. If there's true neglect, to me, if I see that a child has decay and there's negligence there, I will have a serious conversation with the parent, and I'll tell the parent exactly what the implications are very seriously, right? So, in this particular patient, if this is like a chewing issue or whatever we're talking about, right? I would say, mommy, like she's about to hit puberty and her face is going to grow asymmetrically and she's going to live with this the rest of her life. And if you don't do something about it right now, whatever. And honestly, a lot of these patients, and you ask, if this is a financial issue, let's see if there's a way we can help you get over that hurdle. There are programs, there are certain types of, you can go to a teaching facility, it makes it more reasonable. So I think it's very situational, and I think it's our job to advocate for the child as best we can. And I think there's a very fine line between, gross negligence where this child is not being cared for, and maybe there's like financial trouble or the mom doesn't feel like it's necessary or whatever it is. So that's a hard question in this particular circumstance. But I always try to collect as much information as possible. Like what else is happening at home? You know, is the parent bringing the child in for the appointments? And you can get a lot of information just by talking to not just the parent, but also the child. You know what I mean?
Yes.
I hope that's kind of a tough one because, right, it's all very individualized.
Right. Yeah, the problem was with her that, you know, her other girls, you know, they were beautiful and they were successful, and she, you know, was very proud of them. But the youngest one has some problems, and like, she was very, very overweight and stuff, and they had insurance. I knew they had insurance, but she just didn't care. And in my eyes, she didn't care. And so I could have called the
You
child
could have.
protective services. I mean,
Yes.
you lose the patient because that's gonna be.
You don't always. You'd be surprised. You know, the families that I called CPS on came back to see me, all of them. And if you even have a question, if there's a question mark, okay, you lose the patient, but you're advocating for the child, just call. Just call. You know, it's not comfortable, but if CPS knocked on my door, I wouldn't be offended. I would say, you know what? There's someone out there that cares that my child is okay.
Yeah, I wish
Maybe
I
not-
knew that before.
What's that?
I wish I knew I could do that. It never occurred to me that I could call.
You can call, and in fact, you're a mandated reporter, right? So if you're treating children, all of us, healthcare providers, we're mandated reporters. If we suspect neglect, if we suspect abuse, call. Who cares what the parent thinks?
Now, they don't necessarily get in big trouble. If someone knocks
No.
at their door and says, there's a concern.
Exactly. They're not going to jail. The kids are not taken away. It's just someone comes and has a conversation with the parent. And sometimes parents are, especially now, parents are overwhelmed. They're going through a lot. You know what? Maybe they are being neglectful. So maybe that's a little wake-up call, you know, that they need to, that someone else outside is noticing that they're not 100% what they should be.
Thank you.
Don't be afraid to call ever. It's the right move if there's a question mark.
Great. Thanks.
First.
Thanks so much, Adi.
Oh, it's an
Now here-
absolute pleasure.
Now, here's a thought that I had as we are ending our dental hour. There's this line that I found, which I think is so meaningful as for us in our line of work, is our first liners. Help your patients with the most important people in their lives. And they will
Oh,
love
well.
you, and you
You can take them from the
can
recording,
become
but
their
it's easier when
for
you get
life.
it. Than
I'm
your
sorry,
pen screen isn't
can we
working.
mute others? So basically, the moment we help them with their children and with their loved ones, they will love you forever.
Sure.
And here's, you know, I was making the association of this month. There's Valentine we just had. Belated Happy Valentine. This is the month for the heart. And heart means love and care. And it's the month for children's health. Who do we most should give love and care to is our children. And then here's what it leads to the next month. It's a month of health and wellness.
Yeah.
And you know, all that as a combination is important in our lives. So you know, this sums up what you said. You truly focus on the pediatric care, and you know, thanks for giving so much of your life away from the family to the university and to the community, and we appreciate so much with everything you do. And sharing your knowledge with us. And again, thank you very much. If no one else has any questions, I think we took a lot of your time and valuable time.
Thank you very much. It's my pleasure.
Thanks
Thank
very
you for
much.
having me. I appreciate it.
Cheers.
Bye, everybody.